Hello, my name is Singh, and today I'll be presenting my oral testimony in which I will be discussing my policy proposal memo for Oregon's Death with Dignity Act. I am a representative from Oregon Health Authority, and my job requires me to ensure that hospitals provide care to patients. In my job's focus, my concentration is on terminally ill patients, which is perfect as it correlates with Oregon's Death with Dignity Act. Now, before I begin today's presentation, I will begin with a small outline so you guys know what to expect. I will begin with providing a little bit of background. Then I will discuss my policy proposal. I will discuss some solutions. I will discuss the costs and benefits. And then I will request assistance from the U.S. Department of Health and Human Services. That will conclude my presentation portion of this assignment. After that, I will have some time to respond to any questions that civilians have. So to begin, I will provide with some background information about Oregon's Death with Dignity Act. The act was passed in 1994, but it was actually implemented in 1997 due to an injunction delay. This act was initially passed to allow terminally ill patients who were suffering from a disease that would lead to death within 6 months the opportunity to voluntarily end their lives. Under this act, physicians who are trained are able to prescribe a lethal dosage of a medication for the patients. Since the Act's implementation in 1997, there have been over 1,900 prescriptions written, and of these, over 1,200 patients have died as a result of participation. Now, you guys might be wondering how a patient might be able to participate under this act. Well, there are specific requirements. To begin with, the patient must be at least of 18 years of age. They must be an Oregon resident. They must be able to make decisions, and they must be suffering from a terminal disease which leads to death within 6 months. Once a patient shows the physician that they fulfill these requirements, they are able to request their physician to participate in this act and request a lethal dosage prescription to be written. Now, before I talk about some of the implications of this policy, I request the U.S. Department of Health and Human Services to assist me in achieving my goal and to have this policy go through the policy-making process and further become law. Now, firstly, I appeal for assistance for both financial and legal assistance. Financial assistance will be needed to create the programs and to fund the policy needs. Legal assistance will be needed to make sure that hospitals and physicians both are following these new guidelines and that all rules are abided. Furthermore, I would need the U.S. Department of Health and Human Services to act as an oversight and to make sure that everything is being done in accordance with the policy needs. The patients are currently in a very sensitive stage, and we need to make sure that we are able to reassure them of their sense of purpose. And we need to make sure that they do not feel the loss of autonomy or the loss of dignity. This can currently not be fulfilled with the policy as it is written. For this reason, I propose a few changes. Now, before I discuss some policy changes, first I'll discuss some alternative solutions, which can be easily achieved, but these are more on a patient individualized level. The first one is we can encourage the families and friends of the patient to come and spend more time with them. And second, we can encourage the hospital to organize more events in which the patients can participate in. This will help them reduce their feeling of a loss of autonomy. This will help them feel like they can still participate in the activities that make life enjoyable, and the first bullet can still help them. The proposed solutions that I have to improve Oregon's Death with Dignity Act include enforcing mandatory depression screening for patients, mandatory referral to palliative care and hospice care programs, the expansion of palliative care, and required intensive training for both nurses and care providers. Now, for cost and benefit analysis, the cost for this policy would be, financially, we would need funds to employ more physicians and care providers, to fund for training programs, as well as for the palliative care expansion. We would also need, there will also be a legal cost because we would need increased oversight from the U.S. Department of Health and Human Services to make sure that everything is happening in accordance with the policy and its rules. The benefits of passing this policy would be that there will be a decreased number of lethal prescriptions that will be written. There will also be improved palliative care. There will also be an increased number of employed caretakers, which will improve our economy. And there will also be a high quality of life for terminally ill patients, which is the reason that this act was implemented in the first place. And these are my references. I am now open for any questions. Go ahead and ask me the question. Just wait like 2 seconds. Stay in that position.
Yeah, so I had a question after your presentation. What are the benefits to expanding palliative care?
So expansions to palliative care, I think, are actually very necessary. So currently, studies show that we only have one physician for 1,000 patients. And these patients, they're already in a sensitive stage. They're terminally ill. They've been diagnosed with a disease that tells them that they have less than 6 months to survive. In situations like this, I think that patients deserve more individualized care, which cannot be done when, the ratio between physicians to patients is so low. So I think if we expand palliative care and we allow patients to have more individualized attention, that'll increase the number of physicians, and that'll hopefully provide them with the care that they need. So I think expansion will definitely be very helpful in this case.
Okay, thank you.
Thank you so much.
So I'm a lawmaker, and I was wondering, what is the purpose of these mandatory health screenings, and how are these going to benefit patients?
Yeah, that's a very good question. So the reason that I implemented mandatory health and depression screenings is to make sure that patients they have the right decision-making capacity, and they're able to make their decisions for themselves. Now, having these screenings would be able to detect if a patient is suffering from a mental illness or a mental disorder, which would impact their ability to make this decision effectively. And since this decision is so big, it actually is a life and death decision, I want to make sure that they're in the right stage of mind so that they're able to effectively take that decision and that they'll be able to take responsibility for it.
Thank you.
So how are the families of the patients impacted by this legislation?
So the families are definitely going to be impacted by this legislation. Currently, the patients have chosen to voluntarily end their lives, and I think that's a very emotional decision, and I think the families were definitely impacted by that. So now, if we try to decrease participation in death with dignity, I think that the families of terminally ill patients would definitely be impacted, because now their patients are given a second chance to, have a sense of purpose and to, and to live a little bit longer. So I think they'd be happy with this decision.
All right, thank you.
Thank you.
Why should the U.S. Department of Health and Human Services be involved?
So the U.S. Department of Health and Human Services, I think, should be involved. This is a state issue, but I think that help from the federal government and a federal department would be beneficial, as they would be able to provide the funds and all the things that we would be able to need. They will be able to efficiently provide oversight function as well, and they will be able to regulate this and make sure that we're not only in accordance with state law, but also with federal law, and make sure that everything is taken care of.